Hello everyone, welcome back to our next video. This is going to be a tutorial on joints and bodily movement. So here we go. Talking about joints of the body. So for our bodily movement, we are going to be able to move in different patterns, and we have different joints that are named for what type they are. So for first reference, we have what are known as synovial joints. Synovial joints are large joint cavities that have a synovial cavity and synovial fluid. This means that they have space to allow for lubrication, protection, and nourishment, as well as buoyancy for that joint. So we have things like a knee or a shoulder, for example. For our first motion, we have, for example, flexion. Flexion is going to be moving away or through a particular plane. So for this case, flexion and extension is going to be towards or away from the anterior posterior plane of motion. So we can do flexion at a lot of different joint spaces. We can do flexion or extension at the shoulder, at the knee, at the arm, at the elbow, at the wrist, at the ankle. We can do flexion and extension. The best flexion extension examples that we have here are flexion of the shoulder. This is anterior lifting of the hand, or extension of the shoulder. This is posterior movement of the arm. Knee flexion. This is pulling the heel up towards the buttocks. Knee extension. This is kicking the foot forward and straightening the leg. So these are examples of flexion and extension at joint spaces. Again, we can do this at any plane that's going to be moving through the anterior posterior atmosphere, whether that be the shoulder, the hip, the elbow, the knee, the wrist, etc. Here, we have movement of the head. At the neck, we can also have flexion and extension. Flexion moving forward, anterior motion, extension moving backward, posterior motion. Our next is going to be abduction, adduction, and circumduction. At this point, abduction, we have abduction, which is away from the midline of the body. We have adduction, adduction, which is going to be towards the midline of the body. Circumduction is simply circumferential duction, or moving in a circular pattern, right? A spherical movement. We can do circumduction with the arm, rotating the arm around this fixed plane. We can do abduction and adduction with the arm, moving the hand away from the body, bringing the arm and hand towards the body, right? So our abduction and adduction motions can be done by a lot of different places. And that is not limited to the arms and legs, the hand, the toes, the fingers, right? All of these spaces can do ab and abduction. Next is full rotation. We can have rotation to either side, or we can have lateral or medial rotation. So rotation on an axis, for example, your head is going to sit on your C1 vertebrae, right? This is the atlas bone. Right underneath the atlas bone, we have the C2 vertebrae, and this is known as the axis bone. The axis bone is going to allow you to rotate your head back and forth on a swivel. And this is going to be rotation of the head as the neck moves left and right. We also have rotation that we can do towards a certain direction. For example, the hip. The hip we can use to make a lateral rotation movement. This will be turning the leg and foot out so that the toes are pointing away from the body. Medial rotation, other direction, turning the hip, the knee, and the foot in, having the toes pointing down and in towards the body. So the medial and lateral rotation of the upper and lower limb, right? We involve turning the anterior surface of the limb towards the midline of the body or away from the midline of the body. Next, for the ankle, we have dorsi and plantar flexion. Dorsiflexion is flexion of the ankle, pulling the toes up towards the knee. This is towards the dorsal side of the foot. Plantar flexion is pointing the toe downwards. This is towards the plantar surface of the foot, which is the underneath or the sole of the foot. So plantar flexion pointing downwards. dorsiflexion, pulling the toes up towards the knee. If we are going to do inversion and eversion, if we are inverting, that means that we are going to turn the ankle away. If we are going to do eversion, we're going to turn the ankle in towards, all right? So inversion is going to cause the foot to face, or the sole of the foot to face inward towards the midline of the body. Eversion is going to cause the sole of the foot to face up and away, or towards the lateral side of the body. Most of our ankle sprains that we see are due to an inversion movement where we have twisting, all right, and the lateral ankle, the ligaments of the lateral ankle get overstretched as we put too much lateral strain on that side. Finally, we have pronation and supination. Pronation is going to be where the radius rotates over the ulna, and that will be facing downward, all right, so your palm is facing down. Supination happens where we have the radius and ulna parallel. And you can think of supination as the palm being facing up. I always reference a bowl of soup here. So for pronation, you're facing down. Supination, turning the palm up, holding that bowl of soup. Soup for supination. All right, next we have our protraction and retraction and elevation and depression. For the TMJ, or temporomandibular joint, you can move the mandible forward and backwards. So you can jet it forward a little bit. You can pull it backwards a little bit. This is either protraction, pushing it forward, or retraction, pulling it back in towards the chin. We also have depression and elevation. Depression is moving something downward, right? Elevation is moving it upward. So we do this during chewing or talking, where we have depression of the bone slightly, or elevation of the bone slightly. We've heard of opposable thumbs before, and the reason that our hands are able to do such good job of grasping things and holding and all this fine-tuned movement is because of that. Our thumbs are opposable, so they are in opposition to our fingers. So they're able to touch the opposite sides of the fingers, and that is the oppositional movement. So our types of synovial joints here, types of synovial joints are pivot joints. These are uniaxial, only rotation. Hinge joints, uniaxial, allow flexion and extension. Condyloid joints, these are biaxial or two directions. They will allow flexion and extension, abduction, adduction, or circumduction movements. Saddle joints, these are biaxial again. We have flexion and extension, abduction, adduction, or circumduction. Plane joints are multi-axial. They can move in all different directions. And ball and socket joints are going to be multi-axial as well. Again, we can move in all different directions there. So some examples of these, right? The type of joint. For example, the pivot joint, something like our C2, which is our axis bone. This is a pivot joint where it can move and pivot back and forth, right? An example of the saddle joint. This is the thumb, right? For the thumb, we're sitting in a saddle here. Okay, for a plane joint, example is going to be either the wrist or the ankle. Here, for example, we have the ankle shown as a plane joint. For a hinge joint, this is going to allow for movement in one direction back and forth, all right, flexion and extension. We have this at the knee, we have this at the wrist, we have this at the elbow, all right. Next, we have a condyloid joint. Condyloid joint we also see here at the wrist. Next, we have our ball and socket joint. This is usually reserved for the largest, most mobile joints we have at the hip, and we'll have at the arm, okay? The shoulder, we have the glenohumeral joint, right? And at the hip, we're going to have that fascia. So here's another example of this. You can see the example of the ball and socket at the shoulder here. We've got the hinge joint at the elbow, saddle joint at the thumb. See a gliding or plane joint here. See a pivot joint up here in the neck. And we see an ellipsoid joint, which is going to mean the same thing as the condyloid joint. All right. So those are your different types of synovial joints and joint characteristics. I hope you were able to learn something. Thank you all for joining me, and I'll see you in the next video.